Hakani. She is a consultant psychiatrist currently practicing in South Mumbai. And actually, she has very scary terms in her small write-up which she sent about her. But I can say that she's very passionate about what she's doing. And her ambition is to help people who have a state of mental health problems. Now, it's very easy to say mental health problems. I'll request her to touch upon what is depression. All of us say, oh, I'm very depressed, I'm feeling depressed. What is depression? We keep using this loosely. We tell people, oh, you're looking depressed, do this, do that. So please touch upon it and tell us exactly what is this damn depression. And I'm scared to even say these next couple of words because I'll let her talk about it. Anxiety disorder, bipolar mood disorder, blah, blah, blah. It's too much. So I hope she makes light of it because she can go deep right into our minds. I mean, I'm sure while she was there, she's been looking at all of us, sizing each one up as to what state of depression we are because of. Anyway, I don't want to sort of take more of your time, and I present you Dr. Hakani.
Thank you so much for having me here. I'm very humbled to present in front of you all. I'll be sharing my screen. Can I?
Sure, I'll just do that.
Yeah. So today, like I said, we'll be focusing mainly on depression and positive coping strategies. There are a lot of mental health issues, like Nariman sir just told us, like bipolar, depression, schizophrenia, dementia, ADHD. But today we'll just focus on depression, a little bit of anxiety. So what is depression? It's like he just mentioned that, every day we just loosely use the term, oh, you're depressed, oh, you're sad, okay, something wrong has happened to me, oh, so I'm sad. So these are just the normal ups and downs which happen in our day-to-day life. But that is not depression. That is just sadness, or we're just coping with little stress which we face in our day-to-day life. It causes us pain, but we overcome it. But when do you call it depression? You call it depression when you cannot overcome it. It is perseverative. It lasts for a long duration. It lasts for almost every day. For at least 2 weeks, you're facing the same thing. And because depression affects your personal life, it affects your social life, it affects your work life, it affects all aspects of your life, it affects those around us as well. So it is so for depression, holistic treatment is needed. So what is depression? When you say what is depression, what happens in depression? So first and foremost, there is lack of interest in all or almost all activities. Lack of interest in the hobbies. There is sadness of mood. There is tearfulness, emptiness. The client or the person complains of feelings of helplessness, hopelessness, worthlessness. There is lack of energy. There's difficulty in concentration, lack of self-esteem. Decision making is impaired. There are sleep issues. Either the person sleeps a lot or doesn't get sleep at all. Similarly, there are appetite issues. Either the person starts eating a lot or does not eat at all. The person does not want to meet anybody, keeps himself or herself secluded in his or her room, blocks out himself from all the social accounts, does not go to work. So these all are there are feelings of guilt, and also there is suicidal thoughts of death which are recurrent and frequent. Many times there is a plan also to commit suicide, and the person also attempts suicide, and many times they succeed also. So these are all the symptoms which occur in depression. But why is depression, so important to be treated? Because in depression, when it reaches a certain level, there is a scare of suicide. Suicide is something that you are finding a permanent solution to a temporary problem, which is depression or any other stress in your life, which can be tackled. So why has it become so common today? Everybody is talking about depression. Why has that become so common? Because of the pandemic, the lifestyle of people has changed. Things have changed, and it is a stress again. So the statistics seen has found that there is 65% increase in cases of depression and anxiety in India in between 18 to 24 years of age. So what are the causes of depression? So like COVID has only one cause, okay, caused by a virus results in COVID infection. But depression doesn't have only one cause. It has multiple causes, psychological, biological, environmental, and genetic causes. So what are the biological causes? When a person having depression, there are changes in the brain. We can see in this photo that in a healthy brain, you can see there is good blood flow. The red thing which we can see is the blood flow. But in depressed patients, the metabolism and the blood flow to different areas of the brain is also reduced. There is reduction in the neurotransmitter serotonin in various areas of the brain. The amygdala, which is an emotional center of the brain, becomes hyperactive in patients with depression and anxiety. So these are the structural changes which happen in the brain. So it is a biological, so it is not something that, okay, depression will come and go on its own. No, we need treatment because there are changes occurring biologically in the brain. Second is hereditary. We've seen that, if both parents have or one parent has, the chances of depression in the offsprings are more. If a sibling has, the chances of depression in the brother or sister is more. So there is a genetic predisposition. So, and also psychological factors. If there is stress due to any psychological factors like abuse, neglect, or poor ability to relate to others, because of this, there is stress and there is genetic predisposition, the more likely chances to have depression in such people. And environmental stressors like relationship issues, financial, social issues, changes in jobs, etc. Any major change causes stress. And this can result in burnout, which can result in various mental health issues, including depression and anxiety. So these are the things which have been stressful in the pandemic time, like unemployment, financial desolation, loneliness, a very fast-paced life. We were used to meeting hundreds of people. Now we are stuck at home doing Zoom meetings. Though it saves time, but that personal touch has gone. The human touch is gone. So since it is a very easily treatable condition, the medicines are available. We have a lot of options. So that anybody facing these symptoms should consult a psychiatrist or a psychologist and get treated. One is psychotherapies involving REBT, CBT, interpersonal therapies, relationship therapies, etc. are involved. So it is a holistic approach. So along with psychotherapy, you need medications as well. Today, many people are scared to take medicines that, oh my God, what if I'll be dependent? But these medicines are not dependent forming. They do not produce side effects. If at all side effects are produced, they're manageable. If not tolerable, we can always change to some other medicine or other drug which is suitable to you. The most important thing in treatment is compliance, to follow up with your psychiatrist. It is the most important thing. Because these medicines take 2 to 3 weeks to show their effect. So when your doctor says you have to follow up, continue. The treatment goes on long, but you do get out of it, you do improve, and you do get better. Your quality of life improves. Okay, so since we've finished, this is about depression. Now, the other thing I wanted to talk about is resilience, mental resilience. Like we all have physical resilience, physical endurance, how we increase our physical resilience by exercising, by eating right, by sleeping well. So same way we can increase our mental resilience. Why should we increase our mental resilience? So we can cope better. If we cope better, and we develop positive coping strategies, we can have positive mental health. We can have good mental health. Now, what is resilience? It is the ability to bounce back from tragedy or difficult situations or stressful situations. You and me, we all have a certain degree of resilience. We generally bounce back from various stresses in our day-to-day life. But when the stresses increase, our resilience goes down slowly. If we do not, by time to time, rehabilitate ourselves or rejuvenate ourselves, or take breaks, go on vacations, then our stresses go down. When we go on vacations, we are relaxing our mind and we are trying to improve our resilience, thus trying to cope with the stress. It is a protective effect that we have. Some people have less resilience, some people have more resilience. How we can improve this resilience so we can cope better with the stresses that we face? By learning positive coping strategies. Now, what are they? There are 6 of them. I've divided them into 6 parts. The first part is developing a sense of control. We as humans like to be in control of our surroundings, don't we? We don't like to be not knowing stuff. We are more at peace when we know, okay, what is going to happen. So we make a routine. We make a to-do list. We know that, okay, these things are in my control. So we feel a little calm when we know that we have certain level of control. So this gives us a sense of positivity, confidence, and motivates us to do better. So this also gives us this sense of control. The second is to make goals. The goals is to make smart goals. We cannot just simply make a goal that, okay, I'm going to reduce 100 kilos in 1 month. That is not possible. So your goals have to be very specific. That is, you want to lose 20 kilos. Okay, fine, 20 kilos. But it has to be measurable. So it is kilos that you are measuring or pounds which you will be measuring. So it is measurable. Achievable. I will reduce 2 kilos every month. So that is achievable and doable. It cannot be 2 kilos every day. That is not achievable. And it has to be relevant to what your final goal is. And it has to be timely. So if you have a long-term goal, 1-year-old goal, so you can divide it into multiple mini goals, 1 month's time, and keep a to-do list and try to achieve it. Third is self-care, like how we take care of ourselves, brushing our teeth, bathing every day, dressing well. So similarly, you have to take care of your mind also. Tell yourself, talk to yourself, be your best friend that you can. You don't judge your friend when he or she does any mistake. So similarly, if you have done some mistake, just say, it's okay for me. I did a mistake. I tried to rectify it. I couldn't rectify it, but it's okay. I'm not a bad person. I just did a mistake. And forgive yourself. Don't be too harsh on yourself. Mindfulness. Be mindful of the things around you. When you have a lot of anxiety, your mind is overworked with a lot of worry, stress, what do we do? You try and be mindful where you are. Can you smell something? Can you see something? So when you do that, you come back to the present. Meditate. At least 5 minutes of meditation. Being grateful as to what you have and what the other person does not have, not that way, but grateful that, okay, today I had a nice chat with my daughter for 10 minutes, or grateful for a hot cup of coffee I could get today, or I could reach on time today. Help others. So I think help others, this Rotary Club is there. They're all about helping others, creating awareness, giving back to the society. So I think you all don't need much on explanation on that. And keep yourself busy by doing various things, hobbies, and getting involved in different things that you like. So this sheet is available online. Anybody and everybody can download it, and self-care plan, different types of. What I like here most is, supportive people in my life. So there is nothing wrong in asking somebody for help. So these are the people who will be there to help you when you are overwhelmed or stressed about something. The fourth thing today everybody is coping with is loneliness. There's a lot of loneliness. We've become confined to our homes, and loneliness results in a lot of emotions, anxiety, sleeplessness, depression. So what is loneliness? Loneliness is a sense of lack of emotional connection, and it comes from within. So how do you avoid this loneliness? By reconnecting with your friends and family. Count who are most important people in your life, who give you positive vibes, who make you happy. Reconnect with them. And many times there is loneliness in workplace. I have a lot of clients who come to me that, I am not able to cope at work. We don't know what we are doing, where we are standing in at work. Because when we used to go to office, we had colleagues who used to tell us, that, okay, now you've not done this, you've not done that, you're doing it wrong. But that banter is not there when you're working from home. So find a work buddy, check on each other, ask a supervisor to check on you. And this helps to cope better. Many times this feeling of loneliness, you have to be aware that is it occurring every day? It is so often happening that you are just not able to get out of it. Then it could be a part of a bigger issue like depression. Okay. Along with depression, loneliness, today everybody is facing a lot of anxiety. So depression and anxiety generally go hand in hand. So what happens is when we get a lot of information, we are exposed to social media so much today. WhatsApp is there, Insta is there, Facebook is there, news channels are there, everything. We are getting pings from everywhere. So just confine yourself to the local channels, to the news that affect you. You don't have to see what is going on in something which is not related to your field. Accept uncertainty. Initially, I had said that make a to-do list and develop a sense of control. But also, you have to accept the uncertainties of the things that you cannot control. Like, for example, today you have to reach at work. You are getting down, you don't get a cab. You don't know you're going to get a cab or not, right? Immediately you get out of your office or your driver has not come. You don't know, but still you're okay with it. We do cope with it. So once you realize that we are anyways dealing with the uncertainties in our life, little uncertainties, our mind calms down. And one more thing is for those who worry a lot, the whole day they are worrying. So this doesn't come easy, but when put into habit, your mind does get trained. There's something called as a worry period. Dedicate this 20 to 30 minutes every day, that this is the only time I'm going to worry. So when the worrisome thoughts come, just write it in some diary and say stop. This comes with training, but it does happen. And every day reduce the worry period by 5 minutes. If sometimes it happens that during the worry period, like suppose your worry period is 4 to 4:30, there is no worry thought, it's okay. You're not supposed to worry again during the whole day. We go to the worry period in the next day. So this is again manageable by training your mind. But sometimes what happens is anxiety is so overwhelming. We cannot cope with it at all. It is affecting our day-to-day activities. We're having panic attacks, hyperventilating, rapid heart rate, sense of impending doom. Then you need to seek help and ask your doctor or psychiatrist. Again, like depression, anxiety disorders are very much treatable, very much manageable, and they do improve quality of life. The most important thing is sleep. If you get good sleep, you function better, you concentrate better, and you focus better. So develop a good sleep hygiene habit. What does that mean? No naps during the afternoon. Have a specific wake up time. If you cannot have a specific sleep time, it is important to have a specific wake up time. Suppose if you sleep at 3, your wake up time is at 7 a.m., get up at 7 a.m. Don't keep looking at the clock. Avoid caffeinated products after 6 p.m. Use your bed only for sleep, not for any other activities. If you're gone to bed, you're not getting sleep for 15 minutes. Get out of bed, go into the hall, read some boring book, come back. You should be able to fall asleep. Try taking a hot shower for sleep, before sleep. Before you sleep, there should be a 1 hour wind down time before we go to sleep. And that 1 hour wind down time should not have your any screens. Exposure to screen causes our mind to think that there is still daylight, sun is still there. So what happens when we sleep late? The later we sleep, our mind gets habituated to a 24-hour cycle. So our circadian rhythm has gone from 24 hours to 27 hours. So when our mind has gone to 27 hours, we are not going to sleep at 10 p.m. We will sleep at 1 a.m. And also try and keep looking out of the window when we are working indoors these days. Try and keep looking out of the window so your mind gets aware that it is morning, it is afternoon, it is evening. But if even after doing the sleep hygiene things, you're not able to sleep, then your brain is telling there's something else which is troubling you, there's something else which is wrong. You need to see a doctor for the same and get help for the same. Now, there are various apps available, which I have found a very good app, that is CBT Eye Coach app, which was used by the US veterans for sleep and anxiety, mild level. So this really helps them. I have tried it and I have also used it, and this really helps. This is a very good help app. Okay. So stay safe, stay socially connected while being physically disconnected. Thank you.
Any questions for Dr. Hakani?
Of bipolar.
Sorry?
Yes, please.
Could you just, I hear all the time, many times that so-and-so is bipolar. I want to know what is the meaning of bipolar and how do we know, what kind of a disorder is it? I know that they shift from one to the other all the time and don't pay attention to anything. But how does it happen?
Again, bipolar, it has multifactorial causes, like I said. It could be genetic predisposition must be there. And with some stressor happens, so it increases the chances of getting the bipolar illness. And these people need to be maintained on medicines. With medicines, they live a very good life. They can perform pretty well, and they can also earn pretty well. There are many managers and very elite positions also, those who are bipolar but are functioning very well when they're on medications.
And what is the disorder that hurts them?
See, when they are in the mania, bipolar has different types. So the full-blown bipolar it has mania and depression. So when they are in mania phase of mania, what happens? They become very flamboyant. They have delusions of grandeur. They spend a lot. They do. Their judgment is lost. So they will give finance to. Investments in certain ways which are harmful for them, or give money away, So this is what harms them legally also, and they become over friendly, inappropriate. So this harms them. When in depressed phase, they are not able to focus and they become suicidal, and also they tend to be more because the judgment is fired. What happens? They are more tend to take drugs like cocaine, cannabis, meth, etc.
Thank you, doctor.
Ujo, may I ask?
No, I'm sorry. Go ahead.
In the West, people talk so normally about going to a psychiatrist. But in India, it's hush-hush. And as if, oh my God, it's on the quiet, don't let, even the family members should not know. Why is this fixation, and what is the reason? What does
Maybe people don't understand. They are not aware that this is an illness. But in recent times, I've seen that people have become aware. They have become that they need help with the mental health professionals. And I've seen more teenagers approaching, and those till 30 years of age, they are approaching. And still, there are myths that the medicines are addicting, dependence producing, and it's just because we cannot see the illness. It is all inside the mind. You cannot see it physically. Like you have fever, I can record the temperature. This I have no way to prove unless I do a PET scan or some other scan, which costs 10,000-15,000 rupees. And it's not the money issue, but even after doing that PET scan, the thing is, I'm going to give the same treatment.
The body signals will tell you, no, that okay, that he's depressed or he needs psychiatric help.
Yes, they tell you that when the person is not himself, he's not his personality, he's withdrawn, he's crying all the time. But they feel that, come on, it's okay, get out of it. You will be okay. It's just a stress, just get out of it. But that does not happen. They've tried that, it does not happen. We have to break that cycle. We have to normalize the serotonin levels. That will happen only with medicines. Like in diabetes, you have to give insulin. You have to give other medicines. Otherwise, you cannot digest the food. Your glucose will go high.
Thank you.
Yeah. That's one.
I was wanting to know more or less the same thing that Anil asked, but in addition to that, I'd like to know whether the drugs that are being given to bipolar patients, are they having a lot of side effects? Are they harmful in the long run? Because they have to take for life, I'm told.
Yes. So if they have to take for life, so we see few drugs do have side effects, but they're again manageable. We have to monitor them. You have to monitor the blood counts, the blood levels, etc. But then with all that, it is manageable. And each patient has a different approach, different treatment pattern. One medicine for mood stabilizer may suit one person. It may not suit the other person. So, but we have options available.
So that
and since they are given lifelong, if they were life-threatening, then we would not have given them.
So that means consultations are very important, all true.
Yes, follow-up is very important. If there is any issue if there is any side effect, whether you think it's because of drug or not, you always approach a psychiatrist. And if he feels, he can always change the medicine.
Thank you.
Any other questions, members? May I request then Ashwin Ankat to give Dr. Hakani a vote of thanks. And before that, I'd just like to thank her personally. I think you handled the talk beautifully. I was scared that you will burst into jargon, which will make our people put off their videos. But I think you handled it beautifully. I think your suggestions were very practical. And I think the learning is that it is something which one can't wish away. But the fact that if there is, you should be conscious of it and be happy to consult with somebody. And I think you sort of you put it in such a way. I liked your sort of slides which said about the sleep, because all of us find some problem or the other. Like, for example, there are some nights, I generally knock off, but some nights my brain is working like non-stop for no reason. I know, and then I don't sleep. So I get up, as you say, walk around and then come back again. But, I basically feel what you did was try to put it as practically as possible. And thank you very much for your talk. It was very, very nice to hear you. Ashwin,
Thank you.
Yeah. Thank you, Dr. Jankhana Hakani. It was a contemporary topic, no doubt. During COVID time, everybody will have some degree of depression, either not earning well or not adequately earning, and most of the people must be facing it. But what is scary to me is it could lead to suicide, and which I never knew, frankly. Another good thing I learned is this wind down time of 1 hour before sleep. Now, normally my routine, I don't know about others, is watch TV till you fall asleep and then go to sleep. So this will be worth experimenting. That 1 hour, no TV, no electronic stuff. So again, thank you very much. We all enjoyed your talk, and
Thank you
we'll
very
see you more often. Thank you.
Thank you. Sure, definitely.
Sure.
Thank you.